For individuals who are deaf and blind, facing a world with new guidelines and mandates due to COVID-19 has its challenges. As we are encouraged to wear masks and practice social distancing, those who rely on touch or even lip reading encounter difficulties navigating the world like they used to. I spoke with Commissioner David Darkangelo from the Massachusetts Commission for the Blind about how they are supporting their constituents during this time and how others can be mindful of the needs these individuals have.
Yes, oftentimes these people have significant communication access needs that we really, as an agency, try to address and try to ensure that they have full access and opportunity to independence and self-determination. So around the communication access, oftentimes it's things like tactile sign language. So that's American Sign Language that's delivered by touch in the hand. So obviously the pandemic presented significant challenges with proximity to people and things like that. So we wanted to try to ensure that that was maintained throughout. I think we did a pretty good job of that, working with stakeholders. One of the services that we provide is the programs and services related to their blindness. Oftentimes we work with other partners on the person's plan. So whether that's a residential arrangement through a congregate care type of environment, there are often other agencies in on trying to provide programming and services for our people. And so there's a good level of coordination there that we did. And if any of our frontline service workers that work in any of the group homes are listening, I just want to take a moment to say thank you. Thank you so much for the work you do and that you have done during this pandemic. It's been very challenging times, and these workers really stood by our consumers, and I value that so much, so thank you.
And speaking about the work that these workers have done for the consumers, I want to elaborate a little bit more on that, because I think, these consumers need a lot of support. I'm sure that they have some people that are getting groceries for them, medication. So can you elaborate more on all the work that the workers have been doing for the consumers?
It's really a spectrum. So we have some consumers that do have very significant challenges in several areas or multiple areas. And then we have some that have a different set of challenges or areas that we help them work on. So we try not to think of it with a broad brush. We try to really think of it on a case-by-case basis, and what does every individual consumer need to be successful. We develop plans with every one of our participants and consumers, and really try to stick to the plan to work on that with the consumer and with other people involved in that consumer's life, oftentimes the family and some of the other people involved with providing services for people. But yes, Zydalis, it's root and meat and potato types of things, root cause things like getting to the supermarket to get your groceries, getting supplies that you need to be able to maintain your household, and rudimentary things that I think without the pandemic, we kind of all have, as a society, took for granted. And then we realized that, wow, there's a lot that goes into the supply chain and all of the logistics to be able to get even just kind of rudimentary types of things. So that raised the bar for us, I think. And again, the workers and the level of coordination that was put into that, knock on wood, where's some wood, knock on it. Fortunately, we were able to avert major amounts of sickness. There were some isolated instances, but by and large, our people remain safe. And again, that's a credit to the people themselves and everybody providing services there. Our workers, our colleagues, and the people in the group homes and these other environments, the families involved. So it's really a credit to everybody to ensure that people with significant challenges, oftentimes many of our consumers in this area do have underlying health conditions. We're cognizant of that. So we really tried to make sure that all of the protections were in place to keep them as safe as possible.
Were you concerned that your consumers were going to feel even more isolated during this pandemic?
Yeah, that's actually the number one concern is on a typical blue sky day, and I don't know, 6 months ago before COVID, oftentimes many of the challenges that some of our consumers face is that isolation, is the independence, the challenge to independence and self-determination. Really, that's what we strive to work to provide to our consumers as much as we can. And so then add the challenges that the pandemic brings, yes, that was heightened. So we really have tried extra. We've used technology, whether it be iPads or phones or technologies that we're using now, really anything we could do. And again, it's all case by case. What might work for one consumer maybe doesn't work for another consumer. So we really tried our very best to be able to ameliorate that. And I hope we did it to the level to be able to meet their satisfaction. I think we did in many cases, but it's been a challenge.
And speaking of technology, this pandemic has really forced us to be in more of a remote and virtual world. How are your consumers gaining access to technology, and how difficult or challenging has that been to give them access?
Yeah, great question. And I would say for some, it's worked out very well. For some consumers, they've been able to embrace this technology and utilize this technology, and the technology works for them and suits their needs. For others, though, it's really not available. It's really not an option. So we have worked hard to try to make sure we're getting to all of our consumers, and not just some of our consumers, but really get to all of our consumers. So sometimes that's facilitated communication where somebody else will come in and maybe help. So they'll both join, like we've been doing these town halls, MCB town halls, where we've been using Zoom to communicate with our constituents, our consumers, and we've had them fully accessible. So we've had people using American Sign Language on it with CART and captioning and making the materials accessible, and we've tried our very best to do that. Sometimes that still is not able to do it, so we'll even work on the ground to try to bring somebody else in to be with the consumer, to try to be that extra person in the communication access line and really get them the information that they need so they can participate. Our goal is to have as many people participate as possible, and as commissioner, I take that responsibility very seriously to be able to provide access in whatever way we hear that each person wants that access. We want to be able to meet those needs. I don't know if we're always successful. We certainly try, and I think it's important. I want to hear from you all, whether you're a consumer hearing this now or you're a family member or a caregiver. Please reach out to us because we strive to produce that access. I think we do a good job of it. We try to do a good job of it. And I just want to make sure that we're trying to be inclusive for everybody.
And I want to acknowledge the fact that you yourself have been legally blind since a young age. So you understand firsthand the challenges that your consumers are facing. What has your experience been personally for you during this pandemic, and how has it allowed you to better help the consumers?
Yeah, thank you. I do have the prerogative, although I can see now, I am on the legal definition is 2200 of visual acuity, and I'm right on that when I put my glasses on. But when I take my glasses off, forget about it. I would need a cane or a guide dog. So I'm blessed to be able to have the good usable vision that I do now. And it's actually a little bit of a misnomer. People often, when they think of the archetypal metaphor of somebody who is blind, they often think that somebody who is blind has no vision. In actuality, somewhere between 6 and 10% of our central registry, that's how we register people to get our services, and we deliver services to approximately 26,000 consumers throughout the Commonwealth. About 6 to 10% of that amount of people have no vision at all. And then about 6 to 10% have vision like me. All the rest are somewhere in the middle where they do have some vision or light perception. So I think that's important for people to consider. So I try to bring the prerogative of having no vision because I've lost my vision at times in my life, and I have juvenile X-linked wet retinoschisis. So I have continually vitreous hemorrhage in my eye. So I have blood floating through my eye at all different times. And sometimes it gets really challenging. And so I'm able to rely on that to be able to say, now, if I couldn't hear as well, and I had limited vision, obviously communication is going to be a challenge, and it presents many challenges. So I really want to do whatever we can do to make sure we're providing the programs and services as accessibly and providing the opportunities to be able to participate for all of our consumers, from people with deaf blindness to high partial vision like me, and everybody in between. We're your state government working for you, and we really want to try to make sure we're providing the services as best as we can. I'm not sure we always get there, quite frankly. I don't want to tell you it's perfect. It's not. But we try. And if we find out about a situation, the only way we can solve for a situation is if we know about it. So please contact us. We're there to serve you.
And are there ways that businesses, organizations, or other community places can be aware of these individuals, especially when it pertains to the new restrictions and guidelines that are occurring because of the pandemic?
Yeah, that's a great question. What I would say is be open to opportunities. People with disabilities, people of all different types of disabilities have talent. They have great things to add. They're important pieces of our society. So really just be open to that. I mean, I think oftentimes people think of disabilities, and unfortunately the connotation can be somewhat less than, or, not as much as. I really don't view it that way. I actually think it can be an enhancement. I think bringing people in of all different abilities and diverse opinions, I think is a good thing. I think that enriches our society. So what I would say is be open to consider people of all different abilities. Here we are on the verge of celebrating the 30th anniversary of the Americans with Disabilities Act, the most important civil rights law for people with disabilities, and the strides that we've made over 30 years has been terrific, but we still have a long ways to go, and we'll keep working to do that. So I would say just be open, and don't set limits on people, because we've got some tremendous talent within our consumers. And I think they may break some barriers and some stigmas, and people would be really encouraged by some of the tremendous stories that we have of talent and just really great highlights of the human condition.